Nivishe is actually a Swahili word that means to cover you, but we don't give you clothes, but we sort of cover you by offering dignified, accessible, affordable and culturally sensitive mental health services at the community level. The first community that we are serving are marginalized communities, vulnerable communities, communities that do not have access to services, all health services, including mental health services, but also communities who have gone through so much injustices and inequity when it comes to accessing mental health services in a dignified way. Some of my personal leadership challenges that I have faced is unfortunately we live in a patriarchal world, and the aspect of I have to prove myself every time, if in front of a funder, in front of a donor, in front of a ward. And then there is that thing of Muslim women, there's that bias on Muslim women that Muslim women do not have the autonomy or the voices because they can't speak for themselves. And then when you mention you're from Kibra, because I am so proud of my identity, Kibra is an informal settlement, so you've already been judged automatically. So you have to take a lot of effort to come and prove yourself in whichever room that you go. But I feel like such a thing should not exist, that as a woman leader, I do not need to have to prove myself, to go through different barriers to show you that I deserve an opportunity, I deserve to sit in a certain table, and I'm a human being at the end of the day, despite all the things or all the glasses that you put to perceive me. You guys are more closer to my heart. When you're a founder and a young woman coming from a marginalized community, confidence is not given. You have to learn confidence. Women Lift Health has impacted me because the leader I am right now, if I was not this leader, Nivishe will not have grown. For me, the coaching and the community was the best gift that I got from Women Lift Health, because even until now, the community always come through. Whenever I'm going through leadership crisis, I'm not feeling like I'm not alone. I know I can reach out to people. So I think feeling that void of knowing that I need mentorship, I need coaching, I need somebody to help me do the right thing, because I'm really intentional about growing an organization that will outlast me, and I have to do it the right way, and that includes doing the hard work of working on myself and being the right leader for my organization.
Women Lift Health has really helped Amisa improve in her leadership journey, because I can see her growth, like from the person that she used to be before to now, even in how she's leading her leadership styles. She will show you the way, mentor you, and then allow you to become your own leader.
We have a group of teen moms. Each year we take 2 cohorts, 50 of them, and they go through our mental health and psychosocial support training, maternal mental health training and livelihood programs. That's where we teach them computers and all those kind of things. The idea was, how do we make sure that we create a space for them so that they move away from that shame, guilt, victimization, and knowing that they still have a whole life ahead, and they can be able to support their child and themselves through the Nivishe program.
The impact that I've seen with the girls that we are supporting in the community is really huge. We've had girls that left school, I think, even years ago, but then they managed even to go back, and some are even working. And these are people that even when you talk to them, they tell you they didn't imagine they would ever get like there in life.
I joined Nivishe last year, September, and the time I joined Nivishe, I had given birth and I was stressed. and I could control myself. And you have stress, you don't have anybody to talk to. So my friend told me about this organization, and I came with her. We started learning, and I have seen so much improvement on me. Since joining, I have learned how to raise my baby well and how to control my anger, to control my stress. If I am stressed, it's not necessary for me to always have suicidal thoughts or to think of alcohol as a way of relieving my stress, and to think of bang and many other negative thoughts.
Now that I've graduated, I feel good because out there maybe I'll mentor some people, and then maybe I'll be a role model to other girls.
My aspiration at Nivisha Foundation, I hope that Nivisha Foundation will be a global, I'm a Pan-Africanist, so it will be like a Pan-African mental health organization. It should be the first mental health research center that bases its studies in collaboration with the community. We like moving away from doing researches on the community, but collaborating with the researchers in the community. In short, we want to be the biggest mental health institute in the continent and globally. And it's a big, hairy goal, but I feel like I'm going to achieve it.